You're listening to ABC News.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Good morning, everybody. We're happy to be together once again this Saturday morning. We want to thank Russ in the control panel. He's ready to take your calls. If you have any questions, we're live, not like those other programs. We are live. We've got a pulse. We've got a breath rate.
That's it. We are here.
We're here. I'm
Believe
here
it or
with
not.
John Taransky and Ariel Lederman. Good
Hello.
morning,
Here we
everybody. John, how are you?
I'm great, Doctor. How are you?
We're A-OK.
Ariel, good to have you back on the show.
Thank you. Nice to see you.
Yeah, man, you too.
So turn up your radio so you can hear us. Ha-ha.
Yeah.
No, you don't have to hear us. You don't want to. Anyway, we have lots of news. My name is Dr. Lederman. I'm from Radiosurgery New York. Why are we here? What's our mission? Well, the mission is to try to bring information to people to understand better how cancer is treated and things you can do for your health to make yourself have a healthier lifestyle, live longer, have less problems in your life. So that's our goal. And if you have particular questions, you're always welcome to call us on the show, which is 1-800-848-9222, 1-800-848-9222. A friend of mine said we don't say the number enough, so now I've said it about 4 times.
Yeah, we'll
Right.
make sure we get it out there.
We're located, Radiosurgery New York is a private cancer center. We take Medicare, Medicaid, insurances, which people ask about. Do you do insurances? Yes. We're at 38th and Broadway. We're right in the middle of Manhattan between Macy's and Times Square, so it's really super easy to get to, right?
That's
All
right.
the buses,
Yeah,
trains,
sure.
subways. I take the bus to work every day. It's the best way. I take the subway home. And even though I'm supposed to have the longest commute in America, it's pretty easy, actually, with the mass transit. We have 2 co-hosts today, and we're going to talk a lot about cases and news. There was news, even though it's kind of the middle of the winter, and we just got over this cold, and all the pipes are being fixed. Even our 3rd pipe broke, and it's getting fixed now, and we're back in action.
Woohoo. So what's the news?
Well, there's news. I actually want to talk about a patient first, interesting patient. This is a man who is 50 years old, has prostate cancer. 2007, he had a PSA of 10, so it's already high. PSA is what?
Prostatic specific antigen.
Right, and normally it's considered what level is okay normally?
Less than 4.
Less than 4. So he was 10 in 2007.
That's kind of high.
And he had a biopsy. So he did the right thing. Biopsy was abnormal. He got confused what to do, and guess what bad thing he did?
He cut out his prostate.
He
He had surgery?
He didn't do
Chemo.
anything.
Nothing.
He actually did nothing, although those are all pretty bad things in different ways. So we had a PSA 10, abnormal biopsy, didn't do anything, got fed up with the system, confused, dropped out. And actually, delay in diagnosis is one of the biggest causes of mortality. If you look at the black community, the mortality rate of prostate cancer, I mean, it's a death rate, is 200% higher than in the white community. So this is kind of a story of that. 2014, he comes back. His PSA now is 17, and his biopsy's positive. So he's gone from, I guess, intermediate risk to high risk. He's seen his doctors elsewhere. Didn't do any staging. They didn't look where the cancer is. And he came in for a second opinion, which is really the best possible thing he could have done. Certainly better than the delay. Now, what did it cost him to wait those years? Well, he went from a PSA to 10 to PSA 17. So if you look at the surgical data, his success rate would have gone from 76% down to 69%. So for those people who think that surgery is a cure-all, remove the prostate, it's a cure-all, they are...
Not right.
They're not
wrong.
Right. Wrong. They're wrong.
I have no problem saying that.
That's the word I was going to say. They are wrong. Does surgery remove the cancer guaranteed?
No, nothing.
No. And if you remove the prostate, where does the cancer come back? Well, very commonly it comes back in the same area. Just like when you cut a loaf of bread, the crumbs are there. And what happens when the crumbs are cancer cells?
They can spread and metastasize.
They grow.
Yeah,
Number one, they grow. So if the surgeon handles it and manipulates it and drops crumbs around, what's going to happen?
It's going to grow.
It's going to grow. And actually, there's lots of studies, autopsy and other studies, that show one of the most common sites of cancer after radical prostatectomy is the pelvis itself.
Where they took it out.
So this is a man who unfortunately did nothing. I guess fortunately you can say he didn't have surgery, where he would have had a 76% chance of being cancer-free if he had radical surgery. If he came to us in 2007, his success rate would have been 90%. 90% chance. And I'm reading from the booklet called Prostate Cancer, which we'll send to you at no charge if you call us, and a DVD. It's page 8. It looks at if you went to the chief of urology at a big cancer hospital very close to us versus if you came to us. And Ariel, you're sitting on top of the data.
I have all the data I look at every day.
You have the data, so you look at the data and you will see that for PSA up to 10, our success rate's 90% versus 76% with radical surgery. So we're 18% better than with radical surgery. Now, where does he stand? Okay, so now he's at PSA 17. If you look at the data, with surgery, his success rate falls to 68%. With us, it's still, 86%. So because our treatment is so effective, the drop-off with this increasing PSA is less severe. So he's still most likely to be cancer-free if he comes to us. The improvement of us versus surgical patients is 25%. There's 200,000 men a year with prostate cancer. 25% of those, if they all came to us.
It's 50,000 men.
50,000 lives. So it's dramatic. So with these little percentage points, this is 25% better. You're talking about 50,000 lives. So
and if you call during the week at the number, you'll send the booklet?
Yeah, we'll send the book. You can call during the week. You can call during the night. You can call at midnight.
And it's called 212 Choices?
That's our office number. Right. So that's our office number. But again, the point here is a couple points, one of which is you don't need a delay. If you have prostate cancer, it's not going to go away. It's like an abscess in the tooth, decay. It's not going to get better with time. It's there. The role of cancer is to grow. Cancer wants to take your life.
Sure.
Right?
I mean,
it's a race.
And bigger and bigger.
And
eventually take your life.
Take your life. I mean, cancer's goal is to take your life. It wants to take over your body. So in your body, you've got your own body, which is how God made you. And then you've got these cancer cells, which if you don't stop them, they're going to grow and take your life.
It's not your friend.
It is not. It's the enemy. It's the enemy. So for this gentleman, he came. He seems very smart, very motivated. He understands his best chances are with us. He's going to most likely keep his sex life, his urinary life, keep control. He's not going to end up with a short penis like the men who have surgery, or even not make it through surgery. So we wish him well, and I feel like he's going to do the right thing. We had another man who came in, which was really dramatic yesterday. Now, do you remember? Do any of you remember Flip Wilson? You guys probably are too young.
I never heard of that.
You guys are little babies.
Give us a lesson here.
Yeah,
okay, Flip Wilson was one of the most famous comedians in the 70s and 80s.
Well, this man came home from work. He was going to watch the premiere show of Flip Wilson.
Right.
He laid down. There was a family fight. One of the family members poured lye over his face and chest.
Okay.
He ended up blind and lost his ear and a lot of his skin and never saw again, never worked again. Really sad. And in 2006, he ended up with prostate cancer, and he had 9 weeks of radiation. So, unfortunately, he couldn't see the data, but he's a very motivated man, actually a very smart man. He was reading PC World in my office yesterday, Braille.
Wow. Yeah.
Okay, PC World by Braille. So, very smart man. He's taken his time and learned things. So, unfortunately, he had 9 weeks of radiation. Well, 9 weeks of radiation for his kind of cancer is not as good as our treatment. And that's the point of this talk. So for his risk, he had 9 weeks of radiation. His success rate was 65%. Had he come to us for our body radiosurgery and brachytherapy, it would have been 87%, which is 34% more. So if you multiply the 34% times 200,000, you're talking about
almost 190,000 of that.
No, 70,000. About 70,000 lives saved.
Yeah.
So he's back, and he didn't have the chance or the opportunity to come to us in 2006, I guess. So now the cancer's back. The PSA is going up. It's gone from 2.8 to 3.5 in the last few months. And his doctors just started hormonal therapy.
Mm-hmm.
Now, hormonal therapy, or Dario, what's hormonal therapy for prostate cancer?
Well, the hormones a lot of times feed the prostate, and the hormone therapy blocks that.
Right. Testosterone is the fuels prostate cancer. I mean, eunuchs. What's a eunuch? A eunuch is a person without testicles.
Right.
And without testicles, there's very little testosterone. Eunuchs don't get prostate cancer. Okay. So in the old days, they used to remove the testicles, called castration.
Right.
Now there's medicines to do that, like Lupron, flutamide, things like that, Casodex. So he started on Lupron, Casodex therapy, and he had no staging. The doctors didn't even look where the cancer was. They didn't even biopsy the prostate. So he came to me, and we talked about all the options, which I think everyone is entitled to hear about all the options, right? You should know where your cancer is, what kind of cancer it is, and have the papers in your hand. And when the patients come to us, we give them the papers. So this man has a second chance. If the cancer is localized in the prostate, we might, for example, consider brachytherapy, which is an easy procedure, right. 45 minutes, to give a better dose of radiation to the prostate, because standard radiation is not so great for treatment of the local disease.
Yeah.
And if you can't control a local disease, then the cancer can grow and spread elsewhere. So with his PSA, it's still relatively low, right? Sometimes when people have recurrent prostate cancer, it can be 20 or 50 or 100 or 2,000.
Yeah.
So it's still relatively low, 3.5. So there's a possibility that the cancer is only in the prostate, right? And in that case, sometimes we'll do, for example, localized therapy like brachytherapy, which is putting radiation seeds directly through the skin into the prostate. Takes about 45 minutes. We have our own operating room, and it gives the man a second chance. There's also other localized therapies, which we can talk about, surgery, cryotherapy, etc. We think ours is probably the best, but we talk about all of them. Obviously, if you want hormonal therapy, you can have it, but hormonal therapy doesn't cure anybody with prostate cancer. So we're talking about having a second treatment that has a chance of cure.
And not just suppressing.
Not just temporary suppression, right. So anyway, of course, we wish this man well. We'd like to know where the cancer is. We've sent him for tests to find out where the cancer is, and then we're going to talk back to him about all the other options, and hopefully he'll give us a chance. I believe that he will, because he understands the logic of it, and admire how he's persevered in his life. He's had difficult times, and he's facing another hurdle right now. We're going to go to a word from our sponsor, the man with the real golden voice. So here is Dr. Lederman to tell us about radiosurgery.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you.